I cannot move from a third world to a first world in 30 years. We can do it.
HIV and AIDS continue to pose one of the world's most persistent public health challenges, affecting the most vulnerable and marginalized members of the society. Despite decades of progress in treatment, prevention, and awareness, many communities still face barriers such as limited access to healthcare, stigma, poverty, and lack of adequate support systems. On Sunday, Principal Secretary for Medical Services, Dr. Oma Oluga, flagged off the 2025 World AIDS Day Half Marathon at Nyayo National Stadium, bringing Kenyans together in a powerful show of unity and commitment to ending AIDS by 2030. Catherine Muragat reports.
HIV and AIDS remains one of the most world challenges affecting the most vulnerable members of the society. This year's World AIDS Day, commemorated globally on December 1st, is a rallying call for a focus on ending AIDS and confronting its associated risks, including new infections, unintended pregnancies, and gender-based violence.
Girls who complete secondary school education have lower vulnerabilities than HIV. Teenage pregnancies impact the continuation of education for adolescent girls, with negative effects on our efforts for 100% transition.
We are at a very critical juncture in the response to HIV and AIDS at this point in our country. We've made a lot of progress. We celebrate that progress, but we also have challenges that we need to tackle.
The new HIV infections now affect young people aged 15 years to 24 years. Today's marathon was aimed at raising awareness for the disease, especially for men and boys. According to the National Syndemic Disease Control Council, 54 new HIV infections and 22 deaths are recorded every week. Nominated Senator Veronica Maina called on the various ministers and legislatures, churches to collaborate with parents and teachers to instill knowledge of sex education to the adolescents.
Maybe a time has come for the Ministry of Education, the Ministry of Health, NSDCC, Parliament, legislature, all actors, executive, to come together with the parents and the teachers, to discuss what should we have as sex education.
Kenya imeweza kupunguza ugonjwa wa AIDS na 72% kutoka 2 decades ago.
According to recent data from Kenya's Ministry of Health and the National Syndemic Diseases Control Council for 2025, Kenya recorded 20,105 new HIV infections, 13,239 new cases among females, and 6,869 among females. 4,349 new infections were among children under the age of 15 years. Catherine Muragat, KTN, Nairobi.
The European Parliament has formally rejected a